What's really happening is we're involved in a paradigm shift in Western medicine where there's actual distrust happening. And
well, I didn't mean to sound distrusting. I was just meaning a good idea to explore all your avenues rather than just kind of going down one street and...
Right, definitely. And I'm actually agreeing with you in the sense that there's something to offer. And get the best of both worlds. Remember, you're the most important person in all of this. So for you to look for your avenues and see what is going to be best for you and which person or team of people is going to bring the best material to the table for you. And naturopathic doctors can bring things from the naturopathic world. Surgeons can bring their amazing technology and skill, and the pharmaceutical drug company that have developed the drug to allow transplant to happen. These are all miracles. And I'm just going to encourage you to put yourself in the center of it and draw upon all of the resources that you have available to you.
No, okay. Thank you for that advice.
Certainly. Yeah. And also, after this phone call, if I could be a resource to anybody, please don't hesitate to contact me. If I can help point you in a direction, if you're in a territory or a province or a state, you're not quite sure where to look, or if you just have general questions, I'm happy to be a resource to anybody. Especially working with Mimi. She's just been really, really wonderful. And I consider her a teacher. She's really opened my eyes to this very, very common genetic deficiency that is just really starting to get some airtime.
Can you explain, I'm sure you have more of your presentation to go before we get into the Q&A. Are there some general things that you wanted to talk about in terms of the combination of that spiritual wellness as well?
Oh, certainly. Okay. Well, as I mentioned briefly, the idea that we have three sides to ourselves, or three actual bodies. On the primary level, on the physical level, what's really important is to support your physical processes. And with things that now we're talking about lung, we're talking about liver, and in many cases it's not an actual, from my understanding, a problem of producing the enzyme as much as it is that it gets stored in the liver, and that the liver doesn't release as much of the protein, so that there's a deficiency. And that leads us to lung infections. That leads us open to colds. And so at the basic physiological level, it's really important to keep up your health and your immune system to protect against getting any sort of infection. And there's many ways we can do that by boosting our immune system, getting exercise that's not going to be strenuous or stress the body more. Remember, the more stress we have in our lives, our immune systems are sensitive to stress hormones, meaning that they actually have an inhibitory effect on the T cells, which are an important part of our immune system. So with more stress, we actually open ourselves up to more disease, more infections, through an impact on our immune system. In the mental emotional realm, it's really important to have processes and ways of actively coping. First of all, with the diagnosis, especially with the new one, and if there's a lot of information to be gotten about this, nobody likes to hear any sort of physician saying, "I'm sorry, I have to tell you," or even getting bad news. Or even getting any news that just may be confusing. Alpha-1 antitrypsin deficiency, that's a lot of words for people who aren't used to it. At first, it can be scary. So looking at ways to reduce the stress response and things that are built into reducing our stress response, such as deep breathing or diaphragmatic breathing, can actually be beneficial or help build the strength of the lungs and or the small muscles around the lungs that help it to build, help it to move, help your body to breathe. And then on the spiritual level or the energetic level, beyond the mind-body level, depending on discipline or vocabulary or practice, there's the whole idea of the energetics of health and well-being. And in traditional Chinese medicine, lungs actually represent grief as an emotion. And so that I encourage anybody who are dealing with any sort of lung deficiency, as it would be called in Chinese medicine, or an excessive wind, more a lung deficiency. I ask about grief or grieving processes. I ask about trauma. I ask how they deal with their emotions. And that's an important aspect of the energetic part of it. And again, that's from one discipline. And there's several other disciplines that point towards the lungs and the breath as being one of the core vital energetic processes for life. So there's a lot of, we can hold our breath for maybe a minute or two voluntarily, but after that, we fall down or we pass out, and then the body starts breathing on its own again. So the whole aspect of breath and breathing has a bit of an element of control in it even. That, on more of a mental emotional level, we could look at issues around that perhaps. These are all just various and I was going to say various and sundry, but that's not the right word. There are various approaches to looking at more to just deficiency of a single protein. So I kind of got off on a tangent on that a little bit. Going back to the physiology part of it, it's really important to not only protect ourselves and boost our immune systems and wash hands and whatnot and try not to get sick in the first place, but taking care of the liver is also very important. And when we do diaphragmatic breathing, such as breathing really deeply into our belly, the diaphragm, that's that big muscle that separates our lungs from our internal organs underneath it, our digestive organs. And by doing deep breathing exercises, what we're doing is we're actually compressing and pushing blood through our liver. Our liver lies right underneath that diaphragm. So anytime we do deep breathing exercises, we're actually giving ourselves a liver massage. In addition to sending a signal to the brain, because we have stretch receptors in our in our diaphragm, that when they get stretched, it sends a signal to the brain saying, oh, I'm breathing deeply, therefore I must be relaxed. So it kind of helps to short-circuit some of that stress response that's going on. But other things that are really helpful for the liver, something really simple as lemon juice in water. Now, lemon is a beautiful juice, a beautiful fruit, in that it helps. Outside of the body, it's acidic, but inside of the body, it turns basic or alkaline. And a practice as simple as having a glass of water in the morning with a tablespoon. I prefer organic lemon juice, which actually is cheaper in the long run to buy a small bottle of organic lemon juice than it is to buy a bag of lemons. But not in cold water, but in at least room temperature water. I like to do it as a tea. But having that one glass of water with a teaspoon to 1 tablespoon of lemon will help the liver function better. It'll help with detoxification pathways. And the healthier the liver is, the better it will be for your overall general health, but also specifically in helping to improve detoxification pathways. With alpha-1, you have to be very, very careful, as you know, of environmental toxins and pollutants, especially fumes, tobacco smoke, things like that. So So this is one way that even if we breathe those things in, they're still going to go to our liver to be detoxified. And this is a simple way to improve the health of your liver. And it won't interfere with any drugs or any other regimes that you're doing. Again, it's important to work with somebody who has knowledge and not to just start taking herbs. Some of them can interfere, but there are some that have been shown to be very good, and certain vitamins on a physiologic level that have been very supportive of lung tissue and liver healing. If anybody has any questions as we're going through, please don't hesitate. Maybe I'll stop now and ask any questions about what I've...
Just a quick one for me. You said it was in the morning a glass of water with organic lemon juice is to help your liver.
Yes. Okay. Yes. It also helps to make your body more alkaline or more basic. Disease processes, now this is more for dealing with degenerative disease or even the common cold, cannot exist in an acidic environment. And the more basic or alkaline we bring our bodies towards, the healthier our bodies are, the more it can fight off things like viruses or bacteria, which, when they get a hold in the lungs are a paradise for bacteria. It's warm, it's moist, it's wet, it's beautiful in there. They just love it. So the best way to deal, and we can't get away from it. Remember, bacteria could survive. Actually, bacteria were here before us. They do just fine without human beings. Human beings would probably die off in 24 hours if there were no bacteria. So, the idea is to really try to outsmart what we can perceive as an enemy in many cases, but also a life-giving entity in others.
Can you get the same effect from eating grapefruit?
No, and actually grapefruit's a bit of a conundrum. Grapefruit actually is not recommended for people who are taking medications because grapefruit itself interferes with the P450 cytochrome, or with the phase 2 detoxification pathways in the liver. So if somebody eats a lot of grapefruit, if they're on certain medications, such as hypertension medications, or just to give an example, it will actually interfere with the liver's ability to process certain medications. So grapefruit is actually one thing that, out of anything that we're going to talk about, you can ask me about asparagus, you can ask me about plums, you can ask me about just about any other edible food, but I'm really happy you brought up grapefruit. Because, no, you cannot get it from grapefruit. Or oranges.
Or oranges?
No.
Huh.
Just lemon. The juice of the lemon.
It's good to know.
Mm-hmm.
Yes. Can I ask you, is there anything you can suggest for getting rid of mucus in the lungs in a holistic sort of way?
Mm-hmm. Yeah, now, two aspects to mucus. One is its production, and two is trying to get it out of the lungs. Now, with alpha-1, there is mucus production, and so from a naturopathic point of view and in treating the root cause, first of all, we say, well, let's try to avoid things that are going to cause excess mucus. And for a lot of people, those will be things like foods such as bananas or dairy or some of the common, more mucus-producing foods. So two-step approach for mucus in the lungs. One, let's try to avoid the production of it, including from cough, cold, or environmental pollution. So that involves vacuuming your filter on your furnace at least once a month and having air purifiers so that you're reducing the load on the lungs. But the second part of that is to try to get the mucus out because it's thick, it's gooey. I mean, even the word mucus, I think, is an onomatopoeia. It sounds like it is. It's thick and heavy. So ways to get it out, help the body get it out, are find ways to actually make the mucus thinner so that it's not as thick down there. So something as simple as staying hydrated. But also, there's definitely certain herbs that are very good for that. One of them being mullein as a herb, very useful for toning the mucous membranes of the vital system. And mullein actually reduces inflammation while stimulating fluid production. Thus, it helps to facilitate expectoration. That's more important if there's a hard cough, but also elecampane is a herb specifically for irritating bronchial coughs. It's specifically in children, actually. It's a really nice children's herb, but traditionally it's been helpful in asthma and also the treatment for tuberculosis. But it's really neat because it's a good example of how herbs are complex and the integrated ways in which they work. So in something like that has elecampane in it, the mucilage has a relaxing effect on the lungs, but it also has essential oils that cause stimulation. So the herb both soothes the irritation, but also promotes expectoration. And those are two things that come to mind in terms of herbs for mucus.
I heard about fenugreek. Is that not true about fenugreek then?
Oh no, fenugreek is a good herb. I've seen it in some lung preparations, and I don't have much.
How do you spell the mullein that you just mentioned?
Mullein?
Yes.
Mullein.
EIN. Okay.
Can I just ask you, among the things that produce it, would sugar be also included there?
I would say yes. Sugar, it tastes great, but it really is nobody's friend. Especially white refined sugar. There's other ways to use sweeteners, but sugar itself is actually detrimental to the immune system. There's some studies that show 1 teaspoon of sugar will depress the immune system for 3 hours. Will actually have an inhibitory effect on our immune system. But as for it being mucus forming, I don't think so. I don't think I can say that with confidence that it's mucus forming. I know it is bad for the immune system. And insulin spikes, which when the digestive system, if it's spiking and then crashing and then spiking and crashing, that itself is a physiological depression on the entire system. And then we have to consider anything that you might be sensitive to or allergic to, specifically any foods that you're allergic to. Now, and keep in mind that food allergies and food sensitivities are two very different things. An allergy will actually produce a histamine reaction. And we've seen that with peanut butter or peanut allergies and whatnot, where they can be serious enough to cause death by closing the airways. Food sensitivities, however, are different. They do not involve the immune system, but the body will respond in ways that says, I don't like this food. And one of the main ways it will do that is through, a key way to do that is through producing mucus. Now, let me give you an example, not involving mucus, but involving a food sensitivity. It's funny, I almost said, okay, how many people are allergic to or sensitive to coffee, expecting people to raise their hands? I have to remember I'm on a phone and not in front of a class or a group of people.
I am.
Yes, okay, so with food sensitivities, we have a threshold. And we can have so much of a certain food, and it rises, our threshold stays the same, but our tolerance for it goes up a little bit, and then it will go off or go down in our system. But if we go above that threshold, then our bodies will start to exhibit symptoms. And with coffee, those symptoms are racing heart, or a cough, gagging, maybe sweaty palms. You know that people who are sensitive to coffee, they know that they can only have maybe one coffee a week, or if they have 2 coffees a day, they're fine with 1, but 2 puts them over the edge. And that's the difference between a food sensitivity and why they're important to know how you individually respond to different foods. Wheat is also known to be a very common mucus-producing food for a lot of people. We see more problems with that in things like celiac disease and inflammatory bowel conditions. But it would also be mucus-forming for people who are sensitive to it in the lungs.
We've pretty much entered into our Q&A period. Dr. Mary, I guess just through all of your dialogue and such, we are definitely covering a lot more. But is there anything more in your presentation before we go full force into our Q&A? Is there anything else that you want to touch base on, or just continue with the Q&A?
I'm really comfortable with the Q&A aspect.
Okay.
I think there's only one other point that I wanted to make that will probably come up in a question with respect to the lungs itself, but that's to work on our oxygen metabolism as one more way to work with alpha-1, in that to ensure that our bodies are working in such a way that the oxygen that we do breathe in is being utilized the best way that it can be. And that involves our blood in a lot of ways. Well, in most ways, because it's the blood, it's the heme that carries the oxygen in the blood. So, you know, it's important to check with how are you able to use the oxygen that you're carrying or that you're bringing into your body. And that's a great big wide topic, but the point is it's the oxygen that we're needing, and that the alpha-1 is a big factor in illness that will then impact our ability to metabolize oxygen. So if you could check on, Mimi, as you know, I've got an oximeter here at the clinic, and I check your blood oxygen saturation. That's the ability of your blood to carry oxygen. So there's simple little gadgets. Your doctor may or may not have one. I think I might have gotten mine at Costco, to tell you the truth. So,
is that the portable battery-operated ones?
Yes, they just go on your finger.
Okay, yes, I know it's for the saturation, but I was told about that here the other day, and I was told sporting goods stores have them too. It's because they have a heart rate monitor in them as well.
That's where I got it. Thank you. Yeah. You can get them through, even on the, because athletes need to work with their blood saturation, their oxygen, ability to carry oxygen. So I just wanted, that's the only other point, that key point that I'd like to bring up, that, when we're coming from a naturopathic approach, which is to look at the root cause and to treat the whole person and not just the symptom, that would be an important point to make.
Okay, can we then start with some other question and answers? Does anyone else have another question?
Honey and lemon. Is the honey all right to add to lemon if you get a cold?
Oh, honey and lemon. Yes, that's an older, I want to say an old recipe. One of my favorite recipes when I get a cold, and it happens.
Yeah, I just thought when you mentioned the lemon, well, I like to add the honey, and I thought, well, if it's not good, I won't add the honey.
Yeah, not a problem with honey. It's actually.
Oh,
with me.
Whoa.
Honey and lemon, garlic, and ginger.
Mm-hmm.
I make that as a tea.
Okay.
When I have a cold. Ginger is something that will help you sweat. And garlic is something. Now, this is if you have a cold or trying to boost your immune system. Garlic is a wonderful herb, antibacterial, antiviral, antifungal. That's short answer. Yes, honey is fine to add to the lemon.
I didn't know bananas were bad for mucus. What are your top, say, 5 things that are really bad for mucus, like milk? And I didn't know bananas, but I won't eat my banana anymore.
Well, it's important to get, potassium as well. Top 5.
I know, that's why I was taking it, because of my muscle tightening up, but if bananas aren't...
Yeah. You can get, there's a lot of really great potassium available in root vegetables. Like even a cup of squash has, twice the amount of potassium that banana has. It's just, we commonly know that. And keep in mind, where we are, if we're mostly Ontarians, we're North America, if we're going to have an apple or if we're going to have a mango, and if they both have the same amount of vitamin C in it, this is the idea of eating locally. We're going to absorb more vitamin C from the apple because it's more identical, it's more identifiable to our body than we would, say, from mango. Or potassium. You'll get more potassium from a sweet potato or a squash or some squash than you will from a banana.
Okay.
So, that's kind of some local things. But the top 5, I would definitely say dairy, wheat, bananas. Can I keep it at top 3 and get back to you on the other 2?
Okay, yeah.
Okay.
Can I ask you, Dr. Mary, when you're talking about honey, have you ever done anything with Manuka honey?
Manuka, is that from a specific bee or plant?
Yeah, it comes from New Zealand. And it apparently has antibacterial properties.
First of all, I love anything that comes from New Zealand. As a country, they have such great practices. Most anything that is grown there is grown organically. So, although I do prefer Ontario lamb if I'm going to have lamb, but that's a side note. Honey itself is just...
Sorry?
Honey itself is just an amazing substance. If you're out camping or walking in the woods, you get a scratch, whatever, you can actually put honey. It's antibacterial, antimicrobial. There's a big movement around the use of honey. When I was in India, a lot of people would use it specifically for its medicinal qualities. And it's a superfood. It is a superfood.
Okay, and is it just any regular honey, or like I know that this Manuka honey is very good, but I don't know whether just if you go into the store and buy honeybee honey, will that work the same way?
Well, no, it won't. The shorter answer on that is no, it won't. A lot of the commercially prepared or made honeys are so processed and refined that they're almost empty, that if you're going to work with a honey, see if you can get some from either the Manuka honey or even organic honey from wild honeybees. It's a lot less pasteurized. And keep in mind, honey has a warning. Children under 2 years old should never have honey. They could risk getting botulism. That's the only warning I know about it. But, again, some of the more organic, less refined, less processed honeys will probably be quite a bit more bioavailable for its medicinal qualities.
Thank you.
And do we have another question?
I have one about post-nasal drip.
Mm-hmm.
Just wondering if it could cause a lung infection and what we could use other than the normal nasal spray.
Okay. I have a question. What do you mean by normal nasal spray? Are you talking about a saline solution or one that has medicine in it?
Yes.
Okay. First part of your question, yes, most definitely. Remember, mucus itself isn't a bad thing. Really, what's the bad thing is the bacteria. And if I can wax poetic about mucus, it's actually a beautiful part of our body's natural intelligence. By producing mucus, our body is actually producing a substance that is going to trap bacteria and viruses. And then when we cough, that's our body being beautiful again by trying to bring that mucus up so that we can expectorate it and get it out. So mucus isn't our foe here. It's the bacteria. And mucus is actually something that is brilliant. That is something that our body does in response to trying to get back to that well place. Postnasal drip will definitely, our sinuses and our oral pharynx are lined, just as our trachea are, with cilia. And their job is to try to two things. It tries to trap bacteria and virus before it finds that beautiful breeding ground we call our lungs. And also it tries to keep bringing it up. And if we make mucus, it tries to bring it up so that we can cough it out or blow it out our nose. So now, I don't want to say postnasal drip always causes infection. No, that's not what I'm saying. I'm saying that the particles that get trapped in some of the postnasal drip or in some of that mucus that can go into our lungs, maybe when we're sleeping or if, we cough or we breathe the wrong, when you've inhaled and you've got a little bit of mucus that goes into your lungs, this is when we have to trust our physiology, trust our immune system to try to overcome any sort of infection. But going back to the idea of root cause, let's try to prevent the bacteria or viruses from getting into the lungs in the first place. Now, what can be helpful, what I would recommend, depending on, now keep in mind, for everybody listening, I can't make specific recommendations. I can't to me because she is a patient, but then I'd be breaking confidentiality, so I can't even do it there. But generally, they're a saltwater nasal rinse that doesn't have the medication. If you can try to rinse out your sinus passages on a fairly regular basis, then you will be reducing the bacterial load and the viral load that's in your mucous membranes, in your sinus passages. Another nice way to work with that, even essential oils, gentle essential oil with massage over your sinuses, gentle tapping over it to dislodge some of it before you do some of the nasal lavage. These are all things you can do to help try to decrease the load, and you'll probably see a decrease in the postnasal drip itself. Postnasal drip is a response of the body. Again, the body's trying to produce mucus to say, I'm being irritated somewhere inside.
Interesting. Hello?
Yes? Is everybody still there?
Yep. Out here.
Okay.
We lost somebody.
We did.
Is that what it is?
Yeah.
Oh, you should have told me that. I'm going to get nervous now. I always get nervous when I see people get up and walk out of a presentation. Now I can hear them.
Don't worry, Doctor. We're all listening very intently.
I'm sorry?
Sorry.
I just say we're listening intently.
What do you feel about sprays that, well, not sprays, but the pumps that are used as far as asthma when you're in a problem situation, and obviously that puffer is your agent to get things open. So is there something else you could do rather than use that puffer, and is it injurious to use it continually over years of use?
Well, I think if I'm going to answer in reverse order, anything in excess over years that creates a dependence will be difficult for the body. In terms, remember, I'm coming from the side of trying to help the body do what it wants to do naturally. So, having said that, thank God for puffers. Again, the miracle of modern medical science has saved so many lives through this. I'm fortunate, and I touch wood, that I've not had a problem with asthma or having difficulty breathing, but I'm very aware of that sense of panic. And
so are there natural methods aside from, I guess, preventative, that it not get to that point through naturopathy?
Oh, here's something I wish I could show you, but we're going to have to try to work in a two-dimensional space. If everybody feels the back of their neck, where the C7 vertebrae is, it's largest bone. It's where your neck kind of ends and where your top of your shoulders start.
Got it.
Okay.
I think I got it.
Now, if you go about half an inch, or maybe a centimeter and a half or so, to either side of that big vertebrae, and if you press in deeply, now it's going to hurt. Actually, it'll probably be tender on most of you if you're having lung problems to begin with. Is it tender for anybody?
Yes.
Mm-hmm.
Yeah? Okay. This is a Chinese point, for a Chinese acupuncture point. It's called stop asthma point. That's what I love about Chinese medicine. They don't really throw in a bunch of big words. But if you're getting into an asthma attack, this is a point where even with pressure, just on about an inch or so, like this, and you'll feel it where it's sore. You can do it on somebody who is having an asthma attack, but this is one you can actually do on yourself. That is supposed to help open up the airways. Now that's a physical thing. There's also things that, say, essential oils, that they're more mild. I wouldn't want to really risk a full-blown asthma attack by experimenting with things. Like, make sure you have your proper. That I know is a first aid point, the stop asthma point, and that will be quite effective. And individually, to help the lungs to dilate, I kind of go to a mind-body medicine place of working with the thought that happens first in disarming the alarm response or the stress response. And now here's a case where, deep breathing isn't going to do it because you can't breathe.
Mm-hmm.
So catching your thoughts before it gets to a place of alarm, I think will be helpful in the long run in training yourself, training your mind and your body not to panic when that starts to happen. And even that, because the stress response is hormonal. It's a hormonal cascade that begins with a thought process in our mind. And if the only way to work with that is to work with the thought process itself, and that's training. That takes a long time of training and awareness and being present with what is happening in your body and understanding that your response, your mental response can help have an impact on the physiological response. Let me look into some other things for that asthma, such as bronchodilators. Are you talking more from an acute point of view or more of a subacute?
Actually, to the amazement of my doctor, it actually has, as I've got older, one good thing that came with age, that it is a lot better than what it used to be to when I was younger. And mine, the biggest attacks I have are when I'm too happy. When I laugh too much, I get big asthma attacks.
Oh dear!
I turn to be a more sober person now because of it.
Oh.
But it has got better with age.
Okay.
So I've I don't use the puffers as much, and it always used to trouble me that I was very dependent for a good number of years on two different kinds of puffers. And it's not that I don't use them at all, but it's very infrequently, and I just wondered if there was something else I could do to hopefully get to a point of never using them again. I would always like to have one, just in case, of course. But,
what would come to mind is maybe long-term tonifying the bronchioles, the muscles in the trachea, so that they're not as reactive.
Right.
so they don't tighten up really quickly. And the same thing, remember, whatever happens in your bronchioles with the muscles, same thing happens in our arteries, in blood pressure. And that if we have a thought that is alarming or even mildly irritating, and if our blood, there's muscles, it's all mitigated by muscle response. And those arteries, they can snap shut and blood pressure can go through the roof. It's a very similar process in the lungs. In that there's a muscular aspect in that and muscles are responsive to the stress hormones. They're only doing what they're supposed to do. Again, the body is always going to be brilliant, if not troubling sometimes.
Wonderful, thank you.
No, you're welcome. I'll look up some. I'm going to make a note and look for some other more natural asthma approaches.
We are getting close to our time frame. Maybe we could entertain one more question if there is one.
Yes, I have one.
Thank you.
Dr. Mary, as a caregiver, I myself am a diabetic. Would you have any suggestions to maintain a consistent blood sugar level?
Yeah, and that's, you hit the nail right on the head with that and with diabetes. And it's the idea of having a low glycemic diet or eating low glycemic foods. And what that means is not eating things that are going to be converted to sugar right away. Because the problem with diabetes is the blood sugar spikes. When they go up, and then the body releases insulin, or the person takes insulin, and then the blood sugar crashes. And then the body, the brain, it's the only molecule it eats, or it feeds on, is glucose. And when it gets low, well, then it tells the body to release more blood sugar. So it's the up and down. So eating low glycemic foods with a lot of fiber that are going to hang around in your system a lot longer. Things like carrots are great, but they're what's known as high glycemic, meaning they get converted to sugar pretty quickly. Or white potatoes, for example. So really, the key aspect to that, twofold really, are the dietary aspect of it. And number two is stress, because being a caregiver and being somebody who's dealing with your own diagnosis means there's stress there. And the body is responsive to stress. Our digestive system is responsive to stress. With a lot of people who are diagnosed with any sort of chronic ailment, diabetes, high blood pressure, a lot of these are due to the body's response to the stress hormones itself, which divert blood away from the passive processes, such as digestion, in order that the heart can beat faster, in order that the muscles get tighter. And this is why it's important in alpha-1 as well, too, is that these stress hormones, regardless of what diagnosis we're dealing with, whether it's a genetic deficiency or an obtained chronic diagnosis, a key component is the sensitivity of the muscle cells to the stress hormones, and which causes the muscle cells to tighten. And that's what's going to happen in the lungs. That's what's going to happen in the blood vessels of the heart. And that's what's going to happen in the digestive system. Not so much the muscles, but the blood will be shunted away from digestion and towards muscles. So that's kind of more of a blanket statement around stress itself, but definitely read up on low glycemic foods and watch your stress.
Thank you, Doctor.
You're welcome.
Well, thank you, everyone, for listening in. That does conclude our hour, and I know Dr. Mary could continue with helping us through all of these processes, and we are so appreciative and certainly learning a little bit about our stresses. And Dr. Mary, you bring up an excellent suggestion in terms of going back and doing some research for us and finding out if there are other things that we can do for our bodies. And I'm wondering, and this is just off the top of my head, and I certainly don't want to put you on the spot, but as far as our patients are concerned, they're always so receptive to gaining more knowledge, and I would certainly like to invite you to come to our website, and maybe at periodic times, if there are questions that our patients could put forward and our caregivers, and maybe at a certain time you would be able to respond to those, and we could put those into our website and in our newsletter as well.
What a great idea. I'd be honored to. I'd be really happy to do that. Thank you for that.
Thank you.
That would be great. I just want to remind everybody, too, that next month's meeting is on the 21st. Again, not the usual day. And it's with Dr. Simon Ling, who's a hepatologist at the Hospital for Sick Children and deals with children and mostly infants who have alpha-1 and works in close consultation as a result with the transplant team there. So that'll be May 21st, same time, same place, same phone numbers. And I'd just like to add my thanks as well to Mimi's for Dr. Mary. It's a different, interesting take on the disease, and that's what I try to tell people in encouraging them to come to this meeting, is that there's a lot of I guess it's the campaign that Pfizer, the pharmaceutical company, is involved in right now, that it's more than medication. Going to see your doctor and taking your prescriptions is obviously a good idea, but there's more that you can do, that you can take control of your own health care by doing sometimes simple things that can really help, and not just relying on your prescriptions. So thank you very much.
Thank you, and
everybody for coming.
I'd like to encourage everybody on that wellness journey to certainly look to a naturopath in your area, and hopefully they can help. And I'm sure, Dr. Maria, you know several. So if people are looking to find one in their location, maybe Dr. Maria would have some suggestions as well for somebody in that locale.
Yeah, I'd be happy to.
Thank you again. Well, everyone, have a safe and healthy month till we meet again. And stay well, and please talk to us. Send us some questions. Jim's always available. I'm always available.